Welcome back to the deep dive. Today, we're looking at something you can probably find on a shelf at your local gas station.
Oh, yeah. Right next to the energy shots.
Exactly. It's green, it's marketed as herbal, and for a lot of people, it's a tool to manage chronic pain or even step down from opioid addiction. We are talking about Kratom.
And it's such a tricky topic because Kratom really seems to exist in two completely different worlds at the same time.
How so?
Well, in one world, it's a harm reduction tool. It's something that genuinely helps people get off heroin or fentanyl. But in the other world, the one we're seeing in the medical data, it's a pharmacological minefield.
And usually that minefield means, addiction or maybe liver damage. But the sources you've brought today point somewhere completely different.
That's right.
We're not looking at the liver. We're not even really focused on the brain. We're looking at the heart's electrical system.
We are diving straight into the electrophysiology of why this plant can actually stop a heart. We have a really startling case report from Heart Rhythm Case Reports.
Yeah.
It's a 2025 paper. And we're pairing that with a huge study from the Journal of the American College of Cardiology from 2023 that looked at thousands of adverse events. So this isn't just one story. It's a pattern.
And the headline here, the thing that grabbed me, is that Kratom can essentially unmask a deadly heart condition called Brugada syndrome. Now, Brugada is...
Yeah.
That's usually genetic, right? Something you're born with.
Typically, yes. It's a genetic disorder of the heart's sodium channels. It can cause sudden cardiac death in young, otherwise healthy people. It's the kind of thing that, kills people in their sleep.
But this case we're looking at suggests you don't need the genes to get the deadly result. So set the scene for us. Who's the patient in this report?
He's a 27-year-old male. Seems perfectly healthy. He does have a history of opioid abuse, which, is pretty much the classic demographic for Kratom use.
He's using it to stay off pills.
Exactly. He's managing chronic back pain with Kratom extract tablets.
And extract is the key word there. We're not talking about chewing a few leaves. This is a concentrated chemical product.
Yeah. That's a crucial distinction. And on this particular day, he takes 6 tablets, which he later admitted was about 3 times his normal dose.
Okay, so he's chasing a stronger effect.
Probably. And the reaction he has, it is not what you'd expect from an opioid overdose. It's not a slow fade.
What happens?
It's violent and it's immediate. Within 1 or 2 minutes of taking the tablets, he has a generalized tonic-clonic seizure.
Wow. The full body convulsion.
The whole thing. He's found post-ictal, that's sort of the confused reboot state after a seizure. He'd bitten his tongue. It was clearly a very serious event.
So he gets to the ER, they run the standard tests, and I'm guessing they hook him up to an ECG to check his heart.
They do. And this is the moment the whole story pivots from a simple overdose case to a real medical mystery. The ER docs look at the ECG readout, and what they see is a type 1 Brugada pattern.
Okay, so for those of us who aren't cardiologists, what does that mean? What does that look like?
So imagine you're looking at the little squiggly lines on the paper printout. In the leads that look at the right side of the heart, V1 and V2, you see this shape that goes up and then curves over like a shark fin.
A shark fin. That sounds bad.
It is very bad. It's a visual signature for extreme electrical instability. It basically screams that the heart is on the verge of collapsing into a chaotic, non-pumping rhythm.
So the doctors see this, and their first thought must be, okay, this guy has genetic Brugada syndrome. He was born with this.
That was the assumption. But then things started not adding up. His lab work, potassium, magnesium, all normal.
Okay.
CT scan of his head was normal. Echocardiogram showed a structurally normal heart. And then they found his medical records from a year earlier.
And let me guess, no shark fin.
The ECG was completely, totally normal. No Brugada.
Right.
No family history of sudden death. This was not something he was born with.
The Kratom didn't just stress his heart. It was like, it was chemically reprogramming it to mimic a rare genetic disease.
That's a perfect way to put it. It's what we call acquired Brugada syndrome. The high dose of Kratom forced his heart's ion channels into the same broken state as the genetic version.
And what happened when he stopped taking it?
They kept him in the hospital for observation, and within 2 days, the Brugada pattern was gone. A week later, his ECG was perfect again.
That is it's wild. The hardware was fine, but the software was being hacked by this plant.
That's the story.
So let's get into the how. How does this happen?
It all comes down to the main active alkaloid, mitragynine. It makes up about 2/3 of the active compounds in Kratom. And mitragynine is, it's what pharmacologists call a dirty drug.
Meaning it doesn't just hit one specific target.
Exactly. It hits a lot of things.
Yeah.
And in the heart, Its main targets are the ion channels.
These are the little gates that control the heart's electrical flow.
Right. For every heartbeat, you need sodium ions to rush into the cells to start the beat. And then potassium ions have to rush out to reset the cells for the next one.
It's like a synchronized electrical dance.
It is. Now, what mitragynine does is it blocks the HERG potassium channel. So think of it like it's locking the exit doors after the crowd comes in. The potassium can't get out.
And if the potassium is trapped, the heart cell can't reset itself.
Precisely. This makes the whole process take longer. We call it prolonging the action potential duration. And on an ECG, we see it as a prolonged QT interval.
Which our patient also had.
He did. His was 482 milliseconds, which is in the danger zone. It makes the heart vulnerable.
But wait, the Brugada pattern, the shark fin, you said that's typically a sodium channel problem, right?
This is the key insight. The fact that he displayed the classic Brugada pattern strongly implies that at these high doses, mitragynine isn't just blocking the potassium exit doors, it's also blocking the sodium entrance doors.
So it's causing a traffic jam on both ends.
It's creating chaos, an electrical imbalance between the layers of the heart muscle. That imbalance is what generates the shark fin. And if it gets bad enough, you slip into ventricular fibrillation, the heart just quivers. And that's it.
Now, a skeptic could hear this and say, okay, that's one guy. He took way too much. He was an outlier. But that JCC study you mentioned suggests this is a broader problem.
It does. This study was huge. They analyzed the FDA's entire adverse event reporting system, and they compared mitragynine to other drugs known to cause heart problems, like methadone.
And loperamide, right, the anti-diarrhea drug people sometimes abuse.
Correct. Both are known cardiotoxins. But when they ran the numbers, mitragynine had the single highest signal for causing ventricular arrhythmia and cardiac arrest.
How high?
They use a stat called the proportional reporting ratio, or PRR. Anything over 2 is a warning flag. Mitragynine's PRR was 8.9.
Wow, so nearly 9 times higher than expected. But the stat from that paper that just floored me was the mortality rate.
It's sobering. Of all the reported cases of arrhythmia or cardiac arrest linked to loperamide, about 37% of the patients died.
Okay, that's high.
For mitragynine, it was 91%.
91%. So,
Yeah.
if kratom triggers one of these events in your heart, you basically don't survive it.
That's what the data suggests. It implies the onset is catastrophic. You don't get a warning shot. And this gets to the concept of the HERG safety margin.
The gap between a dose that works and a dose that kills you.
Right. And for mitragynine, that safety margin is calculated to be around 4.1, which is, it's uncomfortably narrow. It means the difference between a dose that helps your pain and a dose that stops your heart isn't as big as you'd like it to be.
Which is terrifying when you're buying an unregulated product where the strength could vary wildly from batch to batch.
Exactly.
And this all leads to what I think is the central paradox here. People think Kratom is safe because it doesn't do the one thing we all associate with opioid overdose.
It doesn't stop your breathing.
Right. It doesn't cause respiratory depression.
And that part is true. It doesn't recruit a pathway called beta-arrestin 2, which is what leads to respiratory arrest from morphine or heroin, so it feels safer.
Users take a huge dose. They still feel like they're breathing fine, so they think, great, I'm not overdosing.
And that's the trap. They are swapping a very visible risk not breathing for a totally invisible one. Electrical cardiac failure.
It's like the lights are on in the house, but the wiring inside the walls is on fire.
Perfect analogy. You don't feel your QT interval getting longer. There's no internal alarm bell until your heart just stops.
And people don't use these things in a vacuum. The sources point out that kratom it doesn't play well with other drugs.
No, it's a metabolic bully. Mitragynine strongly inhibits the CYP450 enzyme system in your liver.
The system that breaks down and gets rid of drugs.
Right. So if you take kratom, you're essentially clogging up your body's garbage disposal. If you're also taking an antidepressant or a benzodiazepine or even some over-the-counter meds,
they don't get broken down.
The levels can build up to toxic concentrations in your blood. You might take a normal prescribed dose of another medication, but the kratom makes it poisonous.
The sources mentioned a specific cocktail, 4x100. What is that?
It's a recreational mix they see in Thailand. It's basically a chemical storm in a cup. They mix kratom tea with cough syrup, which often has its own active drugs.
Like codeine.
Codeine, diphenhydramine. Then they add a soft drink for caffeine, and sometimes even muscle relaxants. The risk of an arrhythmia from a mix like that is just astronomical.
Are there physical signs of chronic use people should look out for?
The Thai medical sources describe something very specific called kratom cheeks.
Kratom cheeks?
Yeah, it's a darkening of the skin, a hyperpigmentation on the cheeks of chronic heavy users. They also see severe constipation, dry mouth, and pretty significant weight loss.
There's one more warning I really want to flag for people, and that's about anesthesia.
Oh, this is critical. If you are going in for surgery, you absolutely must tell your anesthesiologist if you use Kratom.
Why is that?
It can cause what's called hemodynamic instability. Your blood pressure could just bottom out unexpectedly during the procedure. It also interacts with the anesthetic drugs themselves.
So it could be harder to put you under or harder to wake you up?
Both. The anesthesiologist is basically flying the plane. They need to know if you've been messing with the controls. And they're not there to judge you. They just want to keep you alive.
So to pull this all together, we have a plant marketed as this gentle, natural alternative. But what the science is showing is that it's a potent drug that can block critical channels in the heart.
A drug that can make a healthy heart mimic a diseased one. And it has a narrow safety margin. And according to this data, a shockingly high mortality rate when things go wrong.
It really forces you to redefine what harm reduction means. Yes, you are reducing the risk of respiratory arrest compared to heroin. That's a fact.
But you're trading that risk for a new one, the risk of sudden, catastrophic cardiac death. And for the 27-year-old in this case study who was just trying to manage his pain, that's an absolute tragic trade-off.
So the final takeaway. Someone listening is using Kratom. What is the single most important thing for them to know?
Listen to your body. And I mean literally listen to your heart. If you feel palpitations, if your heart feels like it's racing or skipping, or if you ever faint or have a seizure after taking it, that is not a side effect.
That's a red flag.
That is a 5-alarm fire. That's a sign of potential electrical failure, and you need to get a 12-lead ECG and be completely honest with the doctors about what you took.
It's a powerful reminder that natural does not mean safe.
Exactly. Chemistry is chemistry. It doesn't care where it came from.
And as we keep searching for ways out of the opioid crisis, we have to ask a really tough question. Are we solving the problem? Or are we just trading one mechanism of death for another, moving it from the lungs to the heart?
For some people, it seems we might be. And we need to go into that with our eyes wide open.
Respect the chemistry. Thanks for this deep dive.
Stay safe.